and thank you everybody for inviting me today. If I tell you the truth, I'm very happy because it's also the opportunity to show you a bit of this topic, which is a topic that I've been working for a long time and that finally, for a lot of reasons, is on the spot of all the issues in addictive behaviors, in all the landscape of addictive behaviors. Well, today we're talking about gaming disorder. And the title is Examining Gaming Disorder, Prevalence, Treatment, and Prevention, because I will offer you an overview of this new addictive behavior, process addictive behavior, as you usually say here in Europe, behavioral addiction, just to give you an idea at all levels about this new mental health issue, formally recognized from last year. Because if we are here today, it's because last year the World Health Organization decided to include in the ICD-11, which is the International Classification of Diseases, in its 11th revision, this new addictive problem, gaming addiction. And because of this formal recognition around the world, there was a lot of debate, but the debate, you will see in a few minutes, was coming from years ago. We know this above all scientists and researchers and clinicians, because, well, this was an issue that we knew that more or less in a time was near to happen and finally happened. And because of this big interest now in gaming disorder. Then, the key questions that I will try to answer today for you are the following. First of all, how did scholars and clinicians arrive at a consensus for gaming disorder? Secondly, what are the components underlying gaming addiction? And look that here I have changed the term to gaming addiction because the term gaming disorder is quite new, has only a few months. And all the research and the knowledge that we have until the present is based in gaming addiction, problematic video gaming, and pathological gaming use, and other kind of terms that we have usually used during these years to know about this problem. Also, I will talk a bit about the instruments that we have nowadays to measure gaming addiction, because it's very important to know about this in order to know what is its prevalence or its estimated prevalence nowadays. We need to know about the instruments to understand why this prevalence is. And also we will talk about, I will try to solve this issue for you too, how are diagnoses and treatments managed nowadays around the world, what we know about the prognosis of these treatments, and how could gaming addiction be prevented? Is there any policy option there? And finally, some lessons learned during these years and future priorities to tackle. Let's start for the beginning. I think that this is one of the best slides that they have. The idea is that, as you could see, this umbrella is a metaphor of something that we have been managing in the research with clinicians about this kind of new problems. And this umbrella is the term of internet addiction. I suppose that you know that this week through Google, we were knowing that we were celebrating the 3 decades of internet. We are celebrating, well, we celebrated a couple of years ago, the 2 decades of internet addiction, which means that internet addiction was a problem that emerged when the internet was introduced in our lives. Of course, very good things appeared, and internet is fantastic in so many ways, but also some risks appeared, and that's the thing that is important. And in the mid-90s, this umbrella term of internet addiction appeared, but today we are only to talk about this, gaming addiction. And gaming addiction is not only to talk about the problems with the video games, it's to talk about what type of video games, in what type of persons, in what type of context are causing the problematic that has raised until a situation that an organization like the World Health Organization has decided to include it in their manual. Of course, here we have a lot of things, a lot of kinds of games, like I don't know if there are gamers here, but the Morph games for role-playing games with guilds, or the first shooter person games. Different kind of activities through gaming are causing different kind of problems, but some of them are more prone to produce the addictive symptomatology and the health problem that we are observing in some studies. Then let's focus only in gaming. To understand a bit about gaming, here this is a work that I did last year, only to show you a bit of what is happening in an objective, with objective indicators, with the statistics. Internet use, I requested permission to the International Telecommunications Unit in Geneva to use this kind of graphics for publishing it and using it in this kind of dissemination. Here we can see that during these last 2 decades, the use of the internet worldwide has gone up, but not exponentially really, linearly. This is something that we are discovering now. And to be honest with you, in the last checks that I did, and that are published by this organization, the ITU, maybe this growth will be a bit steady in a few years, because, for example, in Europe, my continent, my original continent, the use is starting to go down, curiously, and in Africa, the use is starting to go up. Then this has some logic with the introduction of the technologies and the novelty, etc. But apart of this is the use. Let's see the bibliometric production of the sciences, the clinicians, the papers that they are publishing about internet addiction, gaming addiction, or disordered social networking. Here you can see again this growing tendency, but look, that is a bit different. Here it looks like more consistent. Here look in gaming, which is the problem that has emerged. At the beginning, even was bigger than the internet addiction, because in fact, video gaming addiction has been researched from the 80s. Before having internet in our homes, there were consoles to playing games. And there were starting to emerge the problems with adolescents, reported above all in studies from US and Anglo-Saxon countries. They were reporting addictive behaviors through the video games offline. Then the problem maybe, well, we can see it here and we know it, was previous to the conceptualization of internet addiction in the mid-90s by the academics. But look, the growing was not very, the tendency was not very high until the last decade. And if we check this in depth, in 2013, when the American Psychiatric Association, the other big health organization that has another important manual, the DCM, the Diagnostic and Mental and Statistical, the Diagnostic and Mental and Statistical Manual for the Mental Disorders, decided to include in the appendix, not in the manual, but in the appendix, third appendix, internet gaming disorder. In this moment, boom, the research emerged, okay? Then this is a factor that we need to be aware. And finally, other parallel, here is social networking, we have for other problems, cybersex. The research has also grown. Curiously, for social networking, started in 2008 and 2009, when Facebook was used in our countries. Facebook was created before, but was spread during the final part of the 2000s, before 2010. Then the research emerged. Then this is only to give you an idea about what has happened during these last 2 decades to understand why we are today talking about the gaming disorder. In the mid-90s, internet addiction was started to be recognized in the academic environments, and research started. If you observe the timing, I put this image only to try to give you the key message that was precisely the moment that internet was starting to enter in our daily lives. Was the moment, because internet has 30 years, yes, but has not been 30 years in our lives. The internet started, depending in the countries, I know better Europe, but we started to be able to buy computers, personal computers, with good prices, and to connect with internet with more or less also good availability and connection around the mid-90s, finishing the 90s, is when the problem started appearing, of course, benefits and risks. Then in the mid-2000s, the problem and the research and the clinicians from not only Anglo-Saxon countries, other countries started to learn about this and to publish the research. And here, in the mid-2010, is when, for example, 2013, the APA decided to include IGD in the appendix. In 2018, last year, the World Health Organization decided to include in the manual, the ICD-11, the problem. Then the recognition came here, but the problem was, as you can see, only to let you know, in my case, I was doing my PhD and working in this issue in 2005 in Barcelona. And I started because my supervisors in that time told me, oh, nobody is doing research in gambling. Someone should do this kind of research. And I was coming from this background of educational technology. And I thought, if I do something about gambling, I want to see what happens with the technologies. And I remember to read in the press. I was starting to read papers, to read the press, only focusing my eyes in this. And I remember to, above all, collect news about problems with the use of the mobile phones, that they still were not smartphones, and above all, problems with video game. And we had cases in Catalonia of, for example, young adolescents that they were going to ski with the school. We have the mountains, the Pyrenees. They were going to do the skiing, and they had accidents, and then they went to the hospital, and because of this situation of being during months without being not able to do anything except playing games, the problem arose in these specific cases. Then this paid my attention, and then I started in this kind of issues. And at the beginning it was hard because it was a little bit difficult to think that this is possible. It's possible that the internet or the games or whatever is really causing harm. But well, finishing in this decade, quite a lot of authors from everywhere have started to arrive to a kind of consensus about this kind of problems. And they are telling us, look, the definition of these new problems are basically repeated behaviors leading to significant harm, and this harm is operationalized as should persist at least for a year. This is important. It's not something that appears during a summer, that a child is too engaged with video games. It's not this. This is called a hazardous game. It's when a person or a child or whatever is for a year with this kind of behavior repeatedly, and this is causing functional impairment, which means it's affecting at least one important sector of their lives. Depending on the age of the person, could be family life, relationships with partners or friends, or your academic performance, or your work or professional performance, whatever, and the stress, the bad stress. And then authors were telling, please be careful. When you will take this kind of simple definition, you need to avoid only temporary behaviors that seems like this but are not this. Temporary things are not this. We need at least a year if possible. We need to be careful that there is no another underlying disorder which is causing the problem, because maybe we have a depression, and the problem of using this kind of internet things is for coping this mood. Then this is very important. And thirdly, maybe they are professionals. Nowadays, there are professionals, very young, playing and competing in video games. I have seen news here in Melbourne about competitions in this. Then we need to take care about, when we talk about gaming addiction, we are not telling that video games are bad. At the contrary, we are only telling, please be careful. This could be potentially risky if these conditions are there. Then this is the most important slide. I will summarize it very, very quickly. These are the two manuals, the DSM-5 and the ICD-11 that we have nowadays. In both of them, differently, gaming disorder or internet gaming disorder has appeared as an addiction, as an addictive behavior, as a process addictive behavior or behavioral addiction. In the case of the DSM-5, look, if you can look their definition, they are telling us is a persistent use of these games, online games, that is causing clinically significant impairment or distress, and if the user accomplish 5 out of these 9 criteria, we can probably class them as an addict in using these type of games. And look these criteria, because probably will be familiar for you, because are criteria that are taken from the research, of course, in video game addiction, but also if you go in depth, and I will show you a couple of examples, this research is based in substance use criteria and gambling criteria. Then look the type of symptoms that we have here. Preoccupation, with the games, which is like a cognitive salience, withdrawal, and symptoms when internet gaming is taken away. Tolerance, this is the one that is still, we are discussing about tolerance, because it's only understood at the moment as the need to spend increasing amounts of time in games. And not always is time, there are more things. Unsuccessful attempts to control the participation in these games, loss of interest of other hobbies, or family life, or friends' life, entertainments, continued excessive use despite knowledge of the problems that are producing the games, that the user deceive and hide this kind of behavior to their significant ones, the use of the internet games to escape from the reality, the problems of our everyday life, or to look for a relief from a negative mood. Sometimes could be to put you up or to put you down, and we know that specific games genres are facilitating to modify your mood, or has jeopardized or lost a relationship, a job, an opportunity because of the behavior, because of the gaming. Was quite detailed, the proposal that the DCM5 did. The ICD decided another kind of a strategy. They have offered also a definition that is quite similar, but more simple. Look, they are telling when the gaming pattern is for more than 1 year and is together with loss of control, salience, and increasing problems, which the outcomes are functional impairment and distress, then this is probably gaming disorder. We need to take care that is not hazardous gaming, this kind of temporary gaming, or is not another kind of mental disorder, like the bipolar disorder. Then here in the website that they have published, that is accessible for everybody, they have introduced this information and a bit more. And this is what has been published, and this is not the consequence. We were debating before this if gaming addiction was or was not an addictive problem. Here I have introduced one of the journals that is well known in the area, the Journal of Behavioral Addictions, has published quite a lot of papers for the pros and the cons. And you will see that even the press, the BBC, has taken some of these papers, one that was talking about moral panics, that was of course in the cons, to express their worry, because of course something new always causes some discomfort or uncertainty about what is happening. And here you have the cons and you have the pros. This is another paper where the authors were discussing the inclusion of gaming disorder in the ICD-11, talking about the need to do so from a clinical and public health perspective. This is what I know better for one reason, apart of being European and working in these issues. The issue that we know is that the problem exists. We know the clinicians that are coping and treating these kind of situations in clinics in Spain, in Germany, in the UK, etc. But we also know that for ethical issues and new policies, this kind of clinicians cannot publish this kind of works. Then, but we know because some of these people are both scientists and clinicians, and we work with clinicians together. In fact, I worked from the beginning with a team in Barcelona that they were offering health-free public service in some issues, mental health issues, and one of them was precisely this, gaming addiction and cybersex, etc. Then we know that this exists and that is going up. Then here I have summarized some of the main evidences that are like more for the pro than for the con. That was my view. And are that there is a clinical entity, which means that independently of our research or what the press is saying, the cases are there, the families, the persons who suffer the issue exist. There is an international consensus on this, above all, being honest, in the US, in Europe, and in Asia, where the problem has raised as a public health problem. Here there are a bit of research too, very well done, but as far as I know, not much, I think. The proportion of gamers exists, but still is low. We need to tell this. It's not as far as I know, an epidemic is something that exists, but in little percentages. Both big health organizations have recognized differently this new disorder because both have enough evidence. And I was thinking when When I was requested as an expert for participating in this side event of the World Health Assembly for explaining a bit of the pros, I was reviewing everything again, and I was thinking maybe, but precisely because I'm independent, I was not included in the APA group or in the World Health Organization group. But maybe in the APA, as far as I know, they decide to include the disorders, a part of the complex process that they have with groups of experts, international experts, etc., through a statistical basis. The DCM is a statistical basis. They need enough evidence, a quantity of publications and evidences to include the disorder. Maybe in that time there was not enough. Well, we know that has increased, but still we know that we have our goodnesses and also our weaknesses. This is what I will show in a minute. But basically, there is enough evidence. Evidence is evidence which is clinical and scientific, with samples, with our community samples and clinical samples worldwide. The studies are psychometric, qualitative, and experimental, but above all psychometric, which is a strength and a weakness at the same time. There are very good systematic reviews and meta-analysis. I will show you a couple of them. And there are public health and policies, as you will see. And the World Health Organization, this is a quote that I have taken from one of their last reports, was telling, uncertainty should not postpone preventive measures. I took this quote because in my culture, we say something like this: better to prevent than to cure. This is something that as I have known from other colleagues that is extended in other countries and cultures too. Then this is probably one of the main reasons of the inclusion of gaming disorder as an addictive behavior. What happens with the measures that we have that are above all tests? Tests or scales or questionnaires that are coming from our literature in internet addiction. And we know nowadays that is not exactly the same. Then here you have a review, a systematic review done by Australian colleagues from Adelaide, that they look for all the instruments. Here they listed these instruments by symptoms, by addiction symptoms. And look, there are symptoms like, for example, withdrawal, that almost all the instruments have withdrawal included. Other symptoms like tolerance, not all of them. And if we go, for example, to the idea of escape, only a few of them. This image is telling us what? It's telling us that not all the instruments that we are using nowadays, not only for research, also clinicians, are covering all the addictive symptoms that are included in these at least two types of proposals for gaming addiction, the one from the APA and the one from the World Health Organization. And in fact, here I summarize, the strength is that, well, we have quite a lot based on valid health models. One of the strengths in the field is that researchers are very good psychometrically speaking, but, well, the research sometimes is based not exactly in the concept of gaming addiction, has been changed. It was for internet addiction, which was taken from gambling addiction and from substance use addiction, and was taken from old models from other manuals, like the DCM-4. And well, few of these scales are starting to be focused in specific genres, like the morph, that are causing more problems in this sense. And few of them are starting to be published not only in English, also in other languages, testing psychometrically their measurement invariance to be sure that we are measuring the same in different places, because if not, it's very difficult to compare. And the most important weakness that we have in the field is that these screening tools, very few of them have been retested in a clinical setting. Then we are starting to tell, oh, this percentage of persons seems to have this kind of problem, but based in what? No clinician was in the last step to double check with interviews, with protocols, if these persons had really the problem. And this is one of the things that I was doing in my last work, checking through a qualitative work with those that were initially classed as problematic, if they were really problematic. And not all of them were. But well, let's see here the next slide about the prevalence. Here I have taken this good meta-analysis published last year about the 3 decades of this gaming addiction problem. And if you see in this figure, the author has listed all the works that he has taken, 16, from before 2017, and he has observed that the average of the prevalence of IGD is almost 5%, which is quite high, no? And here we have works from 30 years, and from different kind of countries, cultures, with different kind of instruments. And I know it because when I was preparing the presentation and I took this, I didn't realize until I was preparing better and better this presentation that 2 of these works were part of my PhD here. And I realized, wow, it's very different. And then I started to look in depth the paper, and they were using scales like the Young Diagnostic Questionnaire, which is a scale with 8 items, that when was published in the finishing the 90s, beginning the 2000s, was not yet validated and was used. Then this is a thing that we know. Then here only to show you, males higher than females, we know that this is happening in adolescents, in adults is changing. And the higher prevalence was in the older studies, using the DCM criteria, for pathological gambling, Asiatic countries. In Asia, this problem is higher than in the Eastern cultures, is higher than in the Western cultures. And with samples with less than 1,000, which is a number that in psychometrics we try to have as a minimum for the analysis. Then it's critical to apply, they were saying, is an author, FAM was saying, it's critical to apply a common methodology for assessing this gaming disorder, because maybe we're not so, do you follow me? So exact. Let's continue. Then, about the diagnosis and treatment. Here I selected another paper from Sussman and colleagues titled Internet and Video Game Addictions, Diagnosis, Epidemiology, and Neurobiology. And they were stating as key points some things that I'm starting to show you through the evidence that we have. For example, they were telling proposed criteria for diagnosis of internet gaming disorder and other digital technology addictions are analogous to those for substance use and gambling disorders, which is good for recognize it as an addictive behavior, but also it's not so good sometimes because it has its own specificities. And people who is working very well on these issues are neurologists, because they are checking through their techniques what is happening in the brains of people who has different kind of addictive behaviors. In fact, they are. The last point was neurobiological evidence suggests that dual processing model of digital technology addictions characterized by an imbalance between the reactive reward system and the reflective reward system. And they were also observing that diagnosis of the internet and video game addiction should include both screening tools and clinical interviews. This is the weakness that we have, that should be, because of red flags, we can have more false positives than expected because of this. We need this filter of the clinicians. And also other issues like academic decline, sleep disruption, and changes in real life activities and relationships, functional impairment, and comorbidity. Epidemiological studies also are limited for the problem that we have with the diagnostic tools that are not really comparable in detail, and for the reason we have this kind of big ranges in the prevalences from 1 to almost 30, okay? And we are mixing, as I was telling you, cultures, everything. And finally, internet and video game addictions are associated with psychological and social comorbidities, such as depression, attention deficit hyperactivity disorder, alcohol use, anxiety, poor psychosocial support, etc. Then, we know now that for the diagnosis, there are good tests that are improving. Some protocols, few of them, but very good, but we need more. The patients are basically adolescents that are coming with their parents. Now are increasing the number of adults. The dual diagnosis is a rule. Basically, in depression, anxiety, and stress, and other problems related with phobias, social phobia, agoraphobia, and other personality traits, and like hostility, etc. And the treatments basically are cognitive behavioral therapy, that when you see the CBT in depth, is sometimes not the classical CBT. They mix, they do something eclectic with the systemic approach, probably because of the parents, because they need to include sometimes the parents, etc. Then, what we know about the patients in a work that we did from Nottingham Trent University with the European Parliament, we extracted the profile of the European gamers, problematic gamers, that were basically high school students, males, playing role games, being excessive or too much time alone at home. They were not realizing about the problem. The parents and the others around were observing the problem, and they were taken by the parents to the clinics. They had an addiction symptomatology that was a bit different from the addiction symptomatology that we knew from the internet addiction and other technological problems. They had specific comorbidities, these ones that that Sussman was telling us before, plus something else, some other kind of personality traits. And the patients then were also had problems in their social sphere, usually. And also the parenting thing seems to be a key factor that could be sometimes a risk or a protective factor, depending. The CBT was working well, it seems, based on the papers that we analyzed, above all from hospitals. After 3 months, if the problem in the patient is taken in its earlier stage, in 3 months they improve quite a lot, and in 6 months they can be considered that more or less the problem maybe has been fixed. But this is only if all the conditions are working well, which sometimes is very difficult. And the prognosis then is good, above all if family or, because sometimes family cannot, significant others are in this process, because above all are adolescents. It's because of this. In Europe, which is a specific framework. Because here in Australia, I took this other example from Daniel King and Del Fabro from Adelaide. They were doing another systematic review like us, but focusing only in the treatment of IGD. And they realized that a few clinical studies report that psychological and pharmacological interventions can reduce the IGD. And they did this because in their review, they observed that the methods of diagnosis are not equivalent. Of course, if they are using these different instruments, as we were observing before, or they are not double checking or with protocols, whatever, then the outcomes are different. Studies do not assess formative change in diagnostic status and post-treatment and follow-ups, which means that the problem is that they took a lot of measures in the baseline before starting the treatment, and in the post-test, when they finish the treatment after 3 or 6 months, they only take measures about the gaming. They don't take measures about the psychological problem that maybe is associated with, or other problems. Maybe the problem is coming not from the person, from the environment, I don't know, the family or whatever, or an stressor that has appeared in their lives, you know, then this is a problem. We need the same measures, at least the most important ones, in all the key moments. And the follow-ups, they were not doing follow-ups, and they were recommending at least a follow-up after 12 months. Above all, with this kind of interventions that are quite short and quite effective. Then this is the things that they were discovering about the treatment of IGD. Now I'm starting to finish. What happens at a global level? A global level, public health, prevention, policy options. I can tell you that from the beginning of the internet use in our lives, governments, non-governmental organizations, NGOs, or even the gaming industry has taken care of this, more or less, better or worse, who knows. But there has been measures from the mid or late 90s, above all in Asia. Because in Asia, I don't know if you know about this topic, but in Asia, this is a public health problem. And they have invested a lot of money and effort because they have a real problem. Then here, only to give you an example, in South Korea, in 2007, they did a very good national strategy, national policy, based on prevention, screening, counseling, and treatment. Very, very well done. It's impressive what they did, and they are working on it. However, they were not successful in one thing. In 2011, they put a policy called the shutdown policy that they decided to cut the internet during the night for avoiding adolescents gaming. And what happened was that during the first months, of course, was affecting because they couldn't, but they found the ways. Something like that, and if I remember well. But the idea is that when the year, because they were testing this for a year, finished, the levels are starting to go not only up, even more than before. Then was counterproductive to say no and to put not always is working. Then in China, in 2008, they declared internet addiction as a clinical disorder and a health threat for teenagers. And they're starting to introduce control mechanisms on internet cafes and anti-addiction fatigue systems, which means when young people or adults are gaming in this kind of online role-play games, usually they receive rewards. No? You do things well and boom, you have more rewards. And you are better and better, and your guild is the better, and things like that. And they were starting to control that the rewards, above all, when they are too much time, too much hours or whatever, were going slowly. They were not receiving the feedback. It's another type of control. Then we have three types of policies. Limiting availability, shutdown fatigue systems, and parental controls. This is proposed by governments and above all from Asiatic countries. Secondly, reducing harm, which means warning notifications and rating addictiveness of games. This has been done above all for the gaming companies. Here I had to tell you that one good thing that I knew when I was doing my PhD was that the gaming industry was starting with the BEGI in that moment, the Pan-European Game Information, that were stamps that they were putting in all the games. When you buy a video game in Europe, you have these stamps, and you, for example, if you see there are icons, if you see a spider, you know that this gaming can produce fear. This is above all for parents, not for the... yes, I was thinking this could be familiar for you. This one is more new, the credit card. This means in-game purchases, that the game could require you, if you want a better, I don't know, thing to fight with, blah, 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 you need to pay. And this is important for the gamers and for the parents to know, maybe in a moment the game will but this is a good practice, at least they know before. This is a good practice. Then what researchers and scientists and clinicians were trying to tell to the gaming industry is, please do the same with the level of addictiveness. They should know that at least they have this risk. And as far as I know, a few developers even are worried and doing these kind of things. And there is a line, and more could be done. Finally, to provide health services for gamers has been maybe the best, I think, because has been the policy option that has followed countries from everywhere, the Eastern and Western countries, these ones, and also US, Europe, Germany, Spain. Basically, here is to provide prevention and treatment programs, and that a patient could ask a family for help, and being treated is possibly free. There are some kind of investments and actions that have been taken and seems that are working well, because at the final, this image, I put it here, we have usually a young person who is really learning differently comparing with us and living differently comparing with us. Internet is part of the lives nowadays and will be. Then at least for them to know and to help them to protect if these things could happen that are, again, I need to tell you, the proportion is little, but exist. Then, just to finish, the final outcomes that we gave to the Parliament, European Parliament, in relation to these topics were, you can do 4 things. You can do nothing, no action, which is the worst, but we need to be aware, that we need to be honest, that some gamers and some families can solve the problem by themselves. Only letting them about few issues and hints and tips, they can manage the problem. Then natural recovery exists, and we need to tell this because it's the truth. Secondly, in the cases that this is not working, natural recovery, to promote, disseminate research, applied research and information for prevent and for promote responsible gaming, video gaming. Also to promote and educate on online and offline health, which is a new concept, online and offline health in young populations, and to support communities, not only the users through the schools maybe, also the parents, also the clinicians, like some governments and some policy options have started to do. Then, final lessons that we have learned during these years. Gaming addiction is one of the proposed process addictive behaviors through technologies that has a longest history. However, sometimes has been mixed with internet addiction and other addictive behaviors, has very good tools, well validated nowadays, but not always clinically tested, need of other strategies for epidemiological studies to guarantee that we are able to compare and to say things with security. There are still ongoing debates while these health organizations are recognizing the gaming addiction. There are debates, which is good. I think it's good because we need to know, honestly, all to be sure what is the problem that we are tackling nowadays. Improvements in research are needed. For example, we know nowadays that we need to take care of what kind of genres in these games, what kind of profiles in the gamers, what type of context. And improvements in clinical settings strategies are also necessary at a diagnostic level and post-treatment and follow-ups, as our colleagues in Adelaida were highlighting in this paper. And there is a need to develop policy options that will fit with the context and the problematics in each case, in both, not only in health, also in education. Here I had something to tell you, but I think that I don't have time. But I help a school in France through a consultancy because they realized and they asked me to do an intervention at the 3 levels, to the children in primary and secondary school, to the parents of these children that they were starting to be worried with this kind of problems, and with the teachers. Then I think that the educational setting is a good one for prevention. And to finish, the summary of this presentation is there is evidence about the existence of gaming addiction, but not so consistent with regards to its diagnosis and treatment. To tackle the health problem, more refinement is needed in the conceptualization, measurement, factors, and clinical diagnosis, intervention, and prevention. Training in this new process addiction and other similar behavioral addictions is needed also in the alcohol and other drugs sector, and research in several domains like neuroscience, applied psychology, public health should advance, while clinicians should be able to update themselves effectively with lots of support that can be provided. And with this, I think that I have finished. Thank you.